Okay. Again, I just will start officially. Good evening. Today we'll have one communication station, then one video station, and one clinical station. So we'll have we have three volunteers. We'll start with these three volunteers today, and we'll share you something what we have learned, and so that you all can clear MRCPCH. I wish everybody keep muted so that it won't disturb others. Only the participant, only the person who is going to take will just. Shall we start? Shravanti, you are ready?
Yes.
Okay. I'll just put up the scenario. You'll have 3 minutes time, so that whenever you are ready, you can even tell me. Okay. Your scenario is this. So this is the communication scenario. You just go through the scenario, and we'll start in 3 minutes.
Okay. This is not.
Yeah.
This is the first time I did communication station. And,
okay. For first time, I think you did very well. Yeah, I can give you some tips to improve, but to be very honest, for the first time, you did very well. Okay. You tell me what are all the points that was good and what are all the points that was not good?
I think regarding providing some information about the hypoglycemic attacks, and I didn't ask about what are the injections, insulin, how many doses he takes. So that are the, I don't know, it's required, but I didn't ask them.
No, you are not supposed to actually ask. That's the statement that has been mentioned here. You are not expected to gather any further information during the consultation. So that is one most important point, and good that you didn't start with the diabetes. So you didn't teach the mother how diabetes comes. So you did stick to the task. That is very most important point that you did. So it is actually a good thing. Somebody has commented, well, you did well, except you can't allow mother to go to trip. Yes, Nida. Others can also put their comments in the chat box. We just discuss. Okay, I will just give you some feedback. You did an introduction, you did a good rapport, and then you asked for the attenders, and then you asked for the prior knowledge. Everything was good. Good that you did start with the diabetes. So I feel, you have to come directly to the point because you have only 6 + 3 minutes. So you just come directly to the point that I know James is going to the trip that is already discussed, and I just want to know what are all you feel. What things are disturbing you? So what do you want to know from me? So we'll just jump to that. And one more thing is certain sentences that you made were little longer. So I want you to break those sentences. That will be that will give you more mark. So we usually call pass the mic. Means you are a little one and a half minute during the first sentence, and instead you break the sentence. Are you with me? Are you following? You want to know. The idea is the mother will be having at least 3 or 4 hidden agendas. So here the hidden agenda is she wants to pack the food. She wants to know how much insulin has to be packed. What if he gets the hypo? So what if the person, that is the son James, will feel if at all she will follow. So all these points are the hidden agendas. So you have to open the hidden agendas. For you to open the hidden agendas, you should keep asking the role player, are you with me? Are you following? Do you have any other concerns? So for that, you should give, I think the role player should talk at least 60%, and we have to talk 40%. If you keep allow the role player to talk, then it will be easier, little easier for us to do the communication station.
Okay.
So that is one point. And then you started with the leaflets. That is also okay. Yes, somebody has written, can we offer here about a meeting with, we'll just go through this so that others also can participate. About meeting with the dietitian, also arrange meeting with teacher who, as the patient is addressed, they want to feel independent. Yes, that's most important thing. So did so I asked you 2 questions. One is, can I pack food and send? You should be little pragmatic here. You should say no. You don't please pack. Instead, you can advise James what to eat. You can advise. You can inform the class teacher what to eat. And see, he is transforming from an adolescent to an adult. So he should know to take care of himself, and he should know to take care of his food. And so this is one opportunity. So like that, you should positively motivate him. And definitely accompanying him is not a good idea. So, so this is the hidden agenda here. I think you can follow me, doctor.
Yeah, I can follow you.
That is the most important hidden agenda here. So I
Yeah.
was very persistent on the accompanying to the script. I think somebody so so the most important point is you should politely tell, I think it is not good, because it's the scenario is teenager. See, this is little confusing scenario, because it is not a straightforward educational task. It is not a straightforward teenager task. So you have everything. It is not a straightforward
Yeah.
information giving task. So it is little tricky scenario. So
Yes.
we just wanted to start with something little tricky, so that you'll have a catch. But good thing is you started directly to the point. And remember, you need not ask any history. So there should be no history. If you ask history, then you'll be undermarked. So
Mm.
so I'll tell you the domains of marking here: information sharing and accuracy of information. That is okay. Then communication skills, rapport, and communication style. So here, you have clarified the roles, shared the agenda, your tone and pace was good. Your level of confidence should be a little bit more. I'm not able to pick up the non-verbal cues because your camera was not on. Mm, but next time,
Yeah.
if somebody is there, if possible, let them do with the camera on, because they will see the non-verbal cues, how your eye contact with the mother means the role player, and then how your body language. You should start moving your hands. So you should give a good body language so that the examiner will be impressed. So that will give you marks there. Verbal listening and communication skills. So that is what I may give you 1 mark there instead of the 2 marks, because you have to actively listen, more listen, and displays the interest with the patient parent. So you are little bit. That's what I wanted to tell you. You are not passing on the mic. So you break it into very small sentence so that the person who is going to be the role player will talk more, allow others opportunity to speak. That's where I can reduce you 1 mark. But otherwise, you did very well. It was a good attempt for the first time, since you said it is first attempt. Then managing concerns and agreeing to the next step. So that also I can give you 1 mark, and then you can underscore by 1 mark, because you didn't say that you didn't agree. You should not have agreed to the mother that she should accompany, because that's why the key is here. It's a teenager.
Yeah.
So on the whole, it was very good attempt. I think I have you have a little bit summarized also. So yeah, I can mute her. Okay. So you can a little bit summarize also at the end. You did a summarization, and you told about the leaflets in the middle. So you keep the leaflet summary, all those written discussions and all down below. I think rest of the things are all okay. I think you should be when you're ready for the exam, when you are going to take the exam, you apply
I
for the
actually hope to, yeah, in June diet.
okay. Where are you
So
taking the exam?
UK. I'm in the UK.
Okay, okay. So you are in the UK. Okay,
Yeah.
good. I think you should be ready by then. You uh, keep attending various classes, and I wish you jump like this and say, "I'm going to present." So I've seen people even before preparation, those who jumped and volunteered have done very well. So that's one good point, brownie point for you.
Thank you so much and giving for this opportunity. Thank you so much.
Thank you. Okay, so shall we move to the next person who is going to take the clinical case?
Hello, am I audible?
Yeah. Dr. Nida, you are audible. Um, Dr. Nida, if you are ready, I'll just start.
Okay, but I cannot put on my camera today.
No problem. Okay. So, once I display the pictures, you should start. I'll give you the command and you'll be starting. We'll finish it in 6 minutes, and then we'll have 3 minutes for the discussion.
Okay,
Is that okay?
yeah,
Start my time. See, in clinicals, you have no time. You'll be sitting outside without any. You don't know. You may sometimes it may be pasted that it is a CVS. It's going to be a CVS examination, clinical examination case. Many times it may not be pasted outside. So you may not know that it is CVS or it is abdomen or it is going to be the others. So you will be knowing only when you enter. So all the 3 minutes outside, don't think anything else. Just keep calm. Don't think about the previous stations. Erase everything from your mind, and when you enter clinical, keep things very calm. So that will help you. Don't think about the structure of presentation, all those things in clinicals when you enter. So as soon as you enter the clinical station, before that, when you are going to wait outside for those 3 minutes, you keep your clinical station number paper ready. So when you go inside, don't search for the paper. You'll be given 10 sheets. So when you go inside, don't search for the paper and waste some half a minute or 1 minute. So that is very crucial. I wish you all keep your papers ready outside itself. Nita, when you are going to take the exam?
uh, May,
May. Okay. Which center?
Pakistan.
Pakistan. Okay, let's start your case. Okay. Nita, you have entered the clinical station. The command is check this girl's thyroid state. The time
Okay,
starts.
okay. So I have entered the station and given my mark sheet to the examiner.
Okay.
Would take permission from mother or the girl for the examination, and would like to make some rapport with her, wash my hands. And how are you?
I'm good.
Okay, so can I check you today? I would like to check your neck.
Yes, doctor.
Okay, so first I would like to inspect inspect from the front, from the side, and also from the back. Um, and also I would like to ask to, can you drink some water? I would like to have the glass of water so she can drink, so I can observe her swelling.
Yeah, you see the swelling going up and down.
Okay, okay. Can you stick out your tongue? Can you show me your tongue?
Yes.
Okay. Is it moving up?
Correct.
Yeah.
Clean.
Okay.
Please.
Okay, now I would like to uh, go behind her and would like to check and would like to examine the thyroid from my hands.
Okay.
Okay, so what is the consistency, the borders?
It's a diffuse swelling, soft swelling. The borders
Okay,
are not very well defined.
okay, okay. Is there any pain anywhere?
There is no pain. The child is not
Okay,
crying.
okay. Can you drink again a sip of water while I'm at the back?
Yes.
So I'm examining while she is like getting a sip of water.
So that goes up and down.
Okay. Okay, I would like to check the lymph nodes right now. The cervical lymph nodes. Are there any cervical lymph nodes?
No cervical lymph nodes.
Okay. Now I will come in front, and I would like to check like the auscultate. I will auscultate on her to see the to check for the bruit.
There is no brewing.
Okay. Now I would like to. Can you give me your hands?
Yes.
I would like to check for the tremors. Is she having any tremors?
No tremors.
Okay. I would like to check the hands for any pallor, for any cannula marks.
No pallor.
I would like to check the axilla for puberty.
Um, the examiner says no need to
Okay.
proceed with that.
Okay. Now I would like to check her eyes. I would like to ask her to see down and to see up whether there is any proptosis of the eye, any swelling of the eyes.
No proptosis.
Okay. And what about pallor?
There is no pallor.
Okay. Now I would like to check for the uh, 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 I would like to complete my examination like by checking her blood pressure. Uh, I would like to check for her hot and cold intolerance, weight gain, and weight loss.
Okay.
So, can you tell me these things?
Uh, uh, what all things you asked? You tell me one by one.
Weight loss or weight gain?
Her growth chart is there, doctor. It is normal.
Okay. Um, hot and cold intolerance.
When you were examining her hand, you felt that she was a little cold.
Okay. So, now would like to examine her, auscultate her heart.
Okay.
Is there any is there any finding?
No,
Okay. Um so I don't know what to check now.
you're done.
Yes, I'm
You
not.
have one more minute to go. You want anything else to be seen?
Uh, proximal myopathy. I would like to check.
Very good.
Can she raise her hands up?
Yeah, she's able to lift her hands. Will
Okay. Can she sit from the? Can she stand from the sitting position?
yeah, she's able to stand from the sitting position.
Okay. Okay. Then I'm done.
Okay, good. Uh, okay, you have some 30 seconds more. I will start with the questions. So, what is your diagnosis?
So I have just examined, and I have found a diffuse large swelling in the front of the neck with no signs of hyperthyroidism. And no signs of hyperthyroidism, and pulse I forgot to check.
Okay,
So this may be a case of um, hypothyroidism, or
okay,
maybe a case of Graves' disease.
okay. What do you think will be the thyroid status?
Thyroid is euthyroid.
Okay. Anything else?
Um,
Okay, so how you are going to manage this type?
okay, first of all, I would like to check for the TSH T3 T4. Would like to do the ultrasound
Okay,
of the neck, and
okay,
would like to check for the antibodies,
okay,
thyroid peroxidase antibodies.
okay. Anything else you want to do, doctor?
Uh, I would like to check for the heart rate.
Okay, suppose you think like this. She has a normal uh, thyroid status, means her TSH is normal, T3 and T4 is normal. What do you think will be this?
So, oh,
The diffuse swelling.
maybe a thyroid carcinoma.
No, her free T3, T4, and TSH is
Okay,
normal.
okay, okay. So that may be a well controlled. I'm sorry, I
She is,
cannot.
she is 13 years. She's an adolescent girl.
Yes.
Okay, so what is
Hashimoto thyroiditis?
okay? So anything else you want to think?
No.
Okay, thank you, doctor. Your time's up.
Okay.
Okay, Dr. Nida, how did it all go?
Uh, yeah, but seem like while doing it, it's really difficult to compile all the things in such a short time. I mean, it seems easy, but it is not.
Yes, yes, absolutely right. Okay. Especially, I think we would all practice and watch many videos online. So communication, even development, your history, all these are all now is going to be without patients. It is only with the role player. So this is going to be the only place where you are going to be with the patient. So we all will sweat like her what she did. So it's a little tough. How you are practicing, Dr. Nida?
Uh, just like
You're working in some hospital?
yeah. I'm working, but not. I mean, in the general pediatric setup. I'm not in the general pediatric setup.
Okay.
Uh, I'm doing the oncology, so
Okay.
I rarely see the general pediatric patients.
Okay. I think you should keep seeing patients. It's a pediatric oncology department or it's a general oncology department?
No, no, it's pediatric oncology.
Okay. So once I went to see patients for my MRCPCH exam, and I went to the oncology department. One of the boys said he had leukemia and he's under treatment. So he was little. I was little worried about his face, and something was not okay. And then I asked him, what is your problem? Do you have any problem in your eyesight or something like that? And then he said, one of his vision, uh, in one of the eyes. He said that there was some drug error or something like that, and he lost the vision in one of the eyes after he came to the oncology department. I was little, I was shocked. And then I made him walk and saw, and he was walking with a limp. So we practiced the eye checkup, then we practiced gait, we practiced neurology with him. So I think you can even start seeing patients, whatever normal patient, and just practice with some senior or something like that, so that you'll go in an order. Let me
Yes.
give you some feedback. So all these are all just to make us improve so that we'll go and do things well there. I'll start with good things. You went behind and examined for the thyroid, and then you asked for the BP, you asked for the heart rate, you check the eyes, you check the hand. Everything is absolutely good. One thing is, as soon as you enter, then you made a rapport, you greeted, and then you did a hand washing, everything. You should look at the environment. You should ask whether there is anything around in the surroundings or any devices. Can anybody say what is the device that is expected in thyroid, even in thyroid status, or it's going to be examination of the thyroid gland? The question may be anyway.
Maybe BP apparatus as well as some medication.
BP apparatus is fine. BP
Yes, sir.
apparatus.
Class 3 class
Yeah, I think somebody has mentioned hearing aid. Excellent, good. So that's what is expected, because Dr. Nida, which condition you'll expect a hearing aid to be on?
Is it pendant?
Yeah, it's a Pendret syndrome. For mostly
okay.
as a Pendret, then you can have a hearing aid. So that is one. Then a glass of water. So you should look. I can see a glass of water. I can see a hearing aid. So then, and for most of the cases, I wish you start from the hand. You just shake the hand and then start from the hand, so that it will be the skin will be like this. Start from the hand. Just roll your hands like that. Go to the axilla. Come to the face. Then come to the oral cavity, neck, lymph nodes, then come to the chest, and then you finish your examination by looking at the CVS and neurology. In this case, if everything is there in time. So what all you will see in the hand? You saw the tremor, you saw the pulse rate. You didn't mention about the rhythm, pulse rhythm, then clubbing, and I said that you felt the hands are cold. So that point you should have a little bit picked up. And BP, which condition you will see? Yeah, sweating here. Somebody has put that. Good. So BP, anything else specific in BP? Anybody?
Yes, sir. Increased pulse pressure, I think.
Yeah, good. That's a wide pulse pressure, probably in hyperthyroidism. That's a very good point. Then eyes, you asked about eyes. You asked about proptosis. There are so many points in eyes. You should ask for the lid edema. You should mention about the lid edema. You should mention about lag of ophthalmos. Then you should lid lag, lid retraction, proptosis, external ophthalmoplegia, conjunctival ingestion. I think all these points are very important in the eyes. Then mouth. Anybody? Anything else in the mouth in thyroid case?
Macroglosia.
Macroglossia, hypothyroidism, okay, good, accepted. You should ask them to
Dry
speak.
mouth. Dry mouth.
Dry mouth, okay. I think you should ask them to speak and check for
Hoarseness.
hoarseness, exactly. So hoarseness, then you should ask for, you should see for dentition. Hypothyroidism can cause delayed dentition. All these points, I think you should see in the mouth, and then you should ask them to protrude and see that you said protrude and see, and you have to protrude and see for the thyroglossal cyst. Okay, then you have to come for the next. You told about the lymph nodes. Then you should start with the inspection, then palpation, and then go to percussion. You did the same. You saw in front, and then you went back, and you asked them to stick out the tongue. You asked them to swallow. Everything is fine, and then you should mention that it is a diffuse or it is a unilateral or a bilateral edema. Then palpation, you stood from behind, you asked for the face, size, shape, consistency, everything. And then you again made to drink. That's a very good point. And then you should come to percussion. Nida, can you tell me what you have to do in percussion?
Okay, I didn't do percussion,
Yeah.
but there's some leaders. I think there's some. We have to focus on the supra sternal or sternal area. I don't remember the percussion thing.
Just about
Yeah,
the
for
sternum.
retroexternal extension. You have
Retrosternal
to,
extension.
yeah.
Exactly, for the retrosternal extension of the mass. And then you have to do auscultate for the carotid bruit, and you have to auscultate the heart. So anything else, anybody she missed in the examination?
Yeah, she missed max edema in especially in case of the hypothyroidism, and she missed also other autoimmune associations. She should also.
Yeah, but one thing is I kept probing her, and she told about the proximal myopathy. That's a very good point. And if you have a time, you should make her sit, and you should allow her to sit on the couch and check for a pendular knee jerk. So you just keep these points in the schema, and then I think it should come just from the back of the mind. Majority of the time, they won't give marks uh, for the diagnosis. They give mark for our approach. So if our approach is going to be good, then it is absolutely fine. Even if you are not going to make a diagnosis, it's not. Majority of the times it's not needed unless it's going to be a straightforward thalassemia or something like that, straightforward case. But in cases like this, yeah, our approach is enough for them to mark us. Yeah, no particular school. There is not going to be history. We are not going to ask the examination. Somebody after on duty. Yeah, I have muted them. So Dr. Sheikh has mentioned performance.
They answered.
Ask any history actually. So coming to physical exam, identification of the signs, rapport and communication. I think people should mute. Yes. Rapport and communication style was good, and there was no any unprofessional contact. So I can give one undermarking for the clinical reasoning, and maybe one undermarking for the physical examination and identification of clinical signs. But on the whole, you did very well, and you have almost you caught up with all the expected points, Dr. Nida.
It is so nice of you to say such nice words.
No, I think you should. Everybody is in this. Everybody used to be in the same boat. You have to practice, keep practicing. That's all. Small nitty things. And even if you take it from me, even if you practice, you will miss 1 or 2 points. We'll keep telling BP, we'll keep telling pubertal score, we'll keep telling plotting the growth chart, and there in that stress, we'll miss one of this or two of this. So you even if you're not going to have any case, you have a big doll in your house, then you practice with the doll, keep practicing with the doll, or with a normal child in your hospital. Okay, then we'll move to the next station, video station.
Thank you.
Thank you, Dr. Nida. Anybody who is going to take the video station?
Sir, me, Dr. Riaz.
Yes, okay. Okay, I'll just show you the. Somebody has asked what are all the differentials. I think this is straightforward pubertal goiter. So I told free T3, T4, and TSH is normal, and I told you the age of the child, and it can be on treatment also. It can be a child who is on treatment, who is on control. So physiological pubertal goiter is more likely to be the diagnosis. Somebody has mentioned it as thyroglossosis, and she asked whether it moves up with the protruding the tongue, and it was not moving, so it is unlikely. Okay, we'll move to the next one. I think you're also nearing 1 hour. You are ready, sir?
Yes, sir, I'm ready. Yes.
Yeah. Okay. I'll give you 3 minutes. You can keep seeing that again and again if you want in the 3 minutes.
Okay.
The video, and then you can start with the video. Okay.
Yes.
Your time starts now.
Sir, where is where? Okay, okay.
I'm sorry. I'll start the time now. There is. Shall I put it once more?
Sir, once more only.
Yeah. You want it once more?
Okay, sir, enough. No,
Enough.
sir, enough. Okay.
Can you show
I can,
one time more, please? One time more, please. I
Yeah,
missed.
yes. Just look at it in the end. Watch carefully. Okay. That's one of the video from my clinic, actually. That girl is my own patient. Okay.
sir, I can see a video of the girl who is doing hyperventilation test. She's, I think, in the OPD setup. And during hyperventilation, and lastly, she is stopped her activity, and there is a staring of her eyes. She is absent from the surrounding, And after some seconds, she becomes so conscious. But at the end, she is some activity like lips making. I felt like this.
Okay.
Epilepsy, and
Your
it can
audio is slightly breaking.
be
Your audio is slightly breaking. After lips making, what did you tell?
then she gained consciousness again.
Okay. 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 Good. So, what is your diagnosis?
My first diagnosis will be absence epilepsy,
Okay.
and second, it can be daydreams.
Okay. Good.
Third, it can be psychological, but less likely.
Very good. Okay. What is the other name for absence seizures?
Sorry, sir, I forget now.
Petit mal epilepsy.
Pet,
Yeah, petit mal. Okay.
petit
Good.
mal, yes, 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 yes.
What do you think will
Yes.
be the etiology here?
Mostly, it is idiopathic.
Okay.
Sometimes it can be associated with generalized tonic-clonic epilepsy.
Okay. So, what is the usual signs and symptoms for which the parents will present to you?
Mostly, they are saying that uh, suddenly she stops her activity and she is not aware from the surrounding. She becomes unconscious from the surrounding, and after some time again, she will gain her consciousness. And
Okay.
also, this hyperventilation, so it can be aggravated by hyperventilation.
Anything else can aggravate this? Anything else can bring out this?
So lack of sleeping?
Lack of sleep, anything else?
No, sorry.
Okay. So you can give some photic stimulations, keep giving some light stimulations, and then that also can bring out this. Okay. So how will you evaluate?
Yes, sir. First of all, I will take history, onset course when it is started and how it progress, and what are the aggravating factors and what are the relieving factors, and what she did up to now. So I will ask about investigations
Okay.
and any history of medication she is taking, and also history of other types of the epilepsy. So I will ask about generalized tonic because it's a very deep association between two,
So
and any family history also I will take.
how much percentage can become secondary generalization?
Sir, this initially in childhood it can be epilepsy, but later on there's some percentage. I forget this thing, but there is association between.
Okay, good. What is the imaging modality, or what is a diagnostic modality that will give you the
Yeah, diagnosis will be EEG,
okay,
which shows that this is a 3 SZ per spike per minute.
very good. And if the EEG is showing something else, it's showing some generalization. Do you want anything else to be done?
Yes, then I will go for imaging. So MRI is a
Very good. Is there any other association with any syndromes?
but no, sir, sorry.
Okay, so what are all the types of absence? This is a child who is around 5 years. What do you
Yes.
call if the
Yes,
same,
sir, there are two types. One is this in the childhood, and one is the juvenile absence epilepsy.
okay, which has a better prognosis?
I think this one is a better prognosis
Okay, so why juvenile has a poor prognosis? Can you tell why?
because maybe it's caused by a secondary cause, mostly in the brain pathology. So that's why.
It can cause more secondary generalizations, and it is less. It can be less amenable to treatment sometimes. Okay, so how will you manage this child? Last question.
Yes, sir. The drug of choice is ethosuximide, but
Okay.
I will involve a neurologist for. this.
Okay. And anything else? If etoxexamate is not working, then what drug you can?
Yes, then this phenytoin, I think.
Generally, we'll avoid phenytoin nowadays. Anything else? Hello?
Yes, sir.
Yeah. Any other drugs?
No, sir, sorry.
You can give valproate.
Just sodium valproate. Okay.
Yeah. Okay. So, yeah, that's the end. Your time is over now. I'll just go to the mark sheet 1 minute. This is very straightforward, and you did very well in this. You identified the clinical signs, and then you did the clinical reasoning. Your management plan was good. So I think you'll be clearly given almost a full mark. So you did give some simple uh, your differential diagnosis were very simple. That is enough. Some people will usually go to very hard differential diagnosis, like they may tell CNS tumors, all those things. So you made your differentials very simple. You are almost there. There is nothing. I don't think that you can. I can give you any answer marking. Um, Anybody else you want to comment? Others? Just you please go through the guidelines book. That is enough for the videos guidelines book, because they ask each and every step from the guidelines book.
Yes, sir, from guidelines. Yes.
That order. So if you have read the guidelines book, it gives you what is the generalization percentage, all those things. So that's all. Anybody else? Do you have anything else to add, comment in this video station? This is one straightforward video session, and nowadays they are keeping it very simple. So they are again and again they are giving patient no palsy. They are giving squint evaluation. They are giving asthma management. If you have gone through the recalls, so this is repeating again and again. So I think if for video station you see a lot of videos, then you do the recalls. I think if you do the recalls, then it is enough. So that is enough. Where are you? When are you going to take the exam, and where are you going to take the exam, doctor?
Yeah, sir, I am from Pakistan, and inshallah in May 18 is my day, first day of the exam.
Okay. Recalls we can share it in the group. We'll share you if you want. A doctor on duty has asked for recalls from where. We can share it in the group after the session. Okay.
Okay, sir. And sir, sir, another one request. So kindly, sir, continue this efforts. Today we got much knowledge. So I'm thanks that you should take this platform.
We will definitely do that. We are planning
Thank
to
you,
do that.
thank you.
We'll definitely do that. Anybody else has anything else to comment? Anybody else? You want something else more? You can put it in the group. We will keep the group open. You can just put your feedback on this session in the group. We'll share the recordings also. So we have started doing this. We'll do at least 2 sessions in a week for next 2 weeks, so that you'll all be very near to the exam, and then we'll see. We'll take it from there. We have another 2 mentors, Dr. Harsha and Dr. Balaji. They'll be putting their classes in the next 2-3 days. I hope you'll all join in the next few. And you please share the link for joining the group to your friends so that they'll also be benefited. I'm getting a lot of thank you messages, and I am deeply indebted to all these messages. Thank you so much. We'll keep coming again and again. Thank you. Bye bye.